Before COVID-19, I've been working on the behavioral health unit. Some responsibilities include assessing and caring for patients with changes in mental status. We run groups such as musical therapy, art therapy, and we distribute medications as needed. We were told that the surge of COVID-19 patients meant that we needed more nursing staff on the regular units. So I volunteered to go wherever they needed me. During my shift, I would say it was my coworkers, they made a really difficult time a little bit easier with all the teamwork we experienced. After my shift, my family, my friends were all there for me after a long shift. I live with my family at home, my parents, my brother, my boyfriend. I had to stay away from them, still do have to stay away from them because I don't want to transmit anything to them even though I am asymptomatic. I kind of just stay in my room. I don't leave my room as much as I possibly can. I wear a mask around the house. I don't want them to get anything. This crisis has changed me personally by becoming more of a confident person and being more appreciative of myself and my family's health and life in general. Professionally, I feel like I've become more confident in my nursing skills and I've become more of a team player. Helping people and helping families with patients with COVID-19 is really important to me, especially since these families aren't able to see their family members that are hospitalized. I really enjoyed using the iPads to help the families communicate with their family members, and helping other people really inspires my work. I think the main impact that the crisis will have on my career is that I really want to involve patients' families more in the care of the patient. Especially as a behavioral health nurse, I know that patient-family connection is a huge factor in how the patient heals and gets better.
I've been in healthcare for nearly 40 years. In these 3 months, I have seen more death than I think I've seen in my entire lifetime in healthcare. It's been overwhelming, to see trailers outside and you're bringing somebody's loved one. And I've had coworkers that lost, parents, and they couldn't see their parents. My role at Mount Sinai South Nassau before COVID-19 was to receive a job on my iPod and go to that patient, introduce myself to that patient, tell them why I'm there. I would bring the nurse in with me, and I would bring that patient to the destination that they were heading to, whether it be OR, whether it be X-ray. My role was to make them relax and at ease, and I would joke with them. I started seeing patients in the hallways, 2 patients in an ER, cubicle, and you started to pay more attention to what was going on. And then you would go home and you'd see the news and you realized what was happening. And I realized right away how much more scared these folks were. This was a whole different level of concern that you saw on people's faces. I watched the staff work on a patient, and then I came back later and I had found out what happened to that patient. I saw the nurse who was going to help me take the person I needed, and she started crying. Your heart aches for everybody, and at the same time, you're just overwhelmed with how wonderful a job everybody did here. Watching the nurses, watching the respiratory therapists, watching them all in action, you're left breathless. You're in awe of them. How they were able to rise above it and do what they needed to do and still let their emotions out. Watching everybody work together for the common good to try to save somebody. And when that patient passed away, we all actually tried to grieve for a moment. You just know that you're here because there's someone's loved one outside that can't come and see them, and your heart breaks for them. So when you go outside and you see people like giving us the food and stuff, it's kind of so cool that they realize, how hard the folks here work and what they're trying to accomplish. You take this personally. If you don't take it personally, you shouldn't be in healthcare.
What most inspired my work during this pandemic was the passion that we as pharmacists have to just make sure that we're doing the best thing for our patients. I remember the day in the middle of March that we started to jump into this COVID-19 pandemic. The additional impact of COVID-19, now that we have this on top of influenza, was pretty tough for the pharmacy. Does this person have COVID? Does this person have influenza? Could they perhaps have both? And then on top of that, now somebody could also have a concurrent pneumonia. So it made an interesting challenge for our infectious disease team and our infectious disease pharmacists to decipher, discern, and treat these patients now that have something else on top of what we're normally used to dealing with. My role changed more into trying to make sure that we have particular medications, appropriate supplies. Are these medications actually safe for these patients? Looking at data and current literature as to what we have to treat COVID patients in the first place. We used professional organizations, including the ASHP and AFA, and reviewed literature extensively. So a lot of times after working all day, we would go home, and the evenings we would spend hours reviewing all of this literature, as well as speaking to our colleagues about, hey, what are you guys doing? What do you think is the safest? What's the best thing we can do for our patients right now with the information that we have? Prior to COVID-19, our pharmacy department was having direct contact with patients to ensure that we were providing medication counseling and answering any questions that the patients may have had regarding medications. Hospitals over the last couple of years are becoming more accustomed to getting pharmacists in decentralized roles out of the pharmacy. Our pharmacists are spending 100% of their day up on the units, and on the units they're rounding with medication teams, including nurses, doctors, dietitians, perhaps even other pharmacists, pharmacy residents, medical residents, as an integral member of medication teams. On those teams, they're actually making recommendations, adjusting doses, and making sure that patients are getting the appropriate treatments. We also have pharmacists stationed in the central pharmacy that have the typical role of making sure that the medications get delivered. During the COVID-19 crisis, we also had some direct patient contact until central huddles decided that perhaps pharmacists should be limiting their time. As much as we want to be frontline pharmacists and have direct patient contact, we might need to start thinking of novel ways that we can still have frontline contact with patients, but perhaps through telemedicine, using methods by which we can communicate with patients that perhaps we're not necessarily standing next to them, but as an alternative means of communication. My passion was just to make sure that we're saving as many lives as we can and making sure that our patients aren't getting harmed during that period.
I always focus on change as a positive. I love change. Change is good. This didn't feel so good. Around the second week in March, when we started to get an influx of patients, my CNO came to me and said, I think you're going to need to focus primarily on staffing and give up your other clinical units. At the time, having gone through many emergencies, I didn't think that was necessary at the time. But then a couple of days later, I was in a great need to give up my clinical areas because of the impact it had on staffing. We every day had to look at the patients coming in, where we can put them, and how we can staff them. So we had to immediately operationalize a labor pool. There were multiple new areas that would be opening, and resources would be needed for those areas. Also, our critical care numbers were extremely high, so we had to do a lot of tier nursing. meaning having one critical care nurse responsible for a larger amount of patients with these ancillary assistant task nurses. Every nurse is not a nurse for every area. So nursing is great because it gives you such a variety of opportunities, but you do get a comfort level, you build teams, and that was all broken during the crisis. So I had to reconnect that and do it quickly. There were nurses from all areas of the hospital that came into the labor pool to take patient assignments primarily, and have been out of that scope or have gone directly into a specialty and never really had med-surg bedside nursing. Or even orientees that left orientation early to take patient assignments. Knowing which nurses could work well together and building those relationships. Whoever had the skill for that type of patient, they used all the resources that we gave them, and we're very grateful for them. Their reaction was fear. The fear of the unknown. They didn't know what they were coming into. They had a lot of concerns about how they were protected and how are they going to be, will they be bringing this home to their families. The staff is and has always been a great asset to the organization because they just stepped up to the plate and did whatever was asked of them. Knowing them and keeping in connection with them will give me a better opportunity moving forward. Hopefully never having a crisis like this again. I feel like we managed a disaster well. It definitely gives me a sense of accomplishment in my career. This was something major that I've never experienced anything like. The organization moved forward and continues to move forward every day. So I'm very proud of that.
Even when I heard about like COVID-19, what was happening in other countries, you didn't expect it to be as bad as it actually was. And it didn't make sense. You know, normally we'll see death, but usually you can kind of justify it with, you know, they're 98 and they have 15 great grandkids and they lived a beautiful life. Instead, now we were seeing people in their 30s that just went from talking to you and seeming okay to being dead within hours. And it's a lot to mentally and emotionally accept too. So I think that it's not just how much death we've seen, but the type of death we've seen, because these are people that shouldn't have died.
I normally take care of 22 patients, and the maximum patients we went up to was 84 in critical care. So I normally have 2 units, and instead of that, I think the top was 6 units. We are literally in the storm sometimes, so I tell my staff, be the calm in the storm. Because if we're all anxious, we're all, overwhelmed, then our patients are gonna feel that, we're gonna feel that, and it's contagious. We still have patients that are still acutely sick. We still have patients that are on ventilators.
And you had to put yourself there even more so because they had no one there. So there wasn't even like an emotional distance that you can kind of normally put. And I think that was hard. And then to call these family members and say, I know I just talked to you 2 hours ago, and that they were kind of stable but critical, but now they're gone. The families can't even wrap their brains around that. Neither can you. The patients were intubated, sedated, paralyzed medically. So you're really FaceTiming and letting them see what their family looks like. You hear they're critically ill, but if your 50-year-old husband walks into the hospital okay, and now we're telling you that they've had a stroke and they've had this problem and that problem, how do you even really understand that? And I think that the FaceTime helped. If it was my loved one, I would want somebody being there for that.
It takes several deep breaths to make it through another patient going through a medical team or another patient expiring. It takes a lot. So you take a lot of deep breaths under the masks. And if possible, get a moment to eat. It has made me stronger. I never knew that I had to pull in the strength to get through each day the way I have. A lot of my strength comes from my own staff, that I feel like if you're gonna be here, I'm gonna be here too. And if we're gonna do this with the patients and take care of them, I'm gonna be there with you. My critical care team has been absolutely hands down amazing. People who are part-time are working full-time hours. People who are per diem are working full-time hours. People who are full-time are working well over their hours. So, we're all putting in a lot of extra time and energy. They have adapted, they have flexed themselves, they have given time after time, hours after hours, and their effort, their hearts, their souls into taking care of the patients. And I just want them to know that I'm beyond grateful for them. The songs that play when a patient is discharged are very meaningful to our staff. It means to us, critical care nurses, that someone's been taken off the ventilator. That means it's one of ours. So it helps with us knowing it's our patients. And when a patient leaves the hospital, truly gracious to know that at least people are walking out the doors, because the first couple of weeks just really felt like no one was leaving.
It was absolutely inspiring. It really was. I was so proud to be part of this team. If I can help them to help these patients, then let's do everything we can. Yeah, because that's what we're here for. I honestly I was naive. I didn't think that like in 2020, something like this on this scale would happen. Nurses in general just need to be prepared for anything, which I think we always thought we were, but now I think we know on what scale we need to be prepared.
As an employee, I'm committed to come in from 9 to 5. But as a nurse, I'm committed to come in whenever they needed me. So when I know the census was going up, I said, oh, I will be on the floors again. And that's fine, but do I have scrubs to wear on Monday or maybe tomorrow? I don't know. But we'll do this together. I know it's possible. And Monday morning, I showed up to work, back on the floor. At that point, I was just very worried. What's gonna happen next? Is my team gonna be okay? Are we all gonna be okay? It was not an easy transition. Whatever was going on at that time, it was just too much to digest. But when I saw the team, and you think back and say, this is nursing, this is the profession I chose, it just came right back. It's just like riding a bike. It's when I actually looked at my patient and talked to them, look at them in the eyes. Because when you connect to your patient, everything just flows. So it was right there when I connected with the patient. That's how it all started. But the most meaningful part of it is I was able to connect patients to their families through technology. When I was on the floor, I was doing virtual visits for patients. I held patients' hands. The most unforgettable experience about it is holding their hands while their families are saying goodbye. And that was really painful. But I tried to tell them they're not alone. The patients are not alone. One night, actually 2 nights, I came home from work and I have a 3-course dinner that my neighbor prepared for us, for my entire family. And they did it twice in 1 week when they know that this was at the peak and we were so tired, we didn't have time to go to the grocery store. They were there. They texted us and say, don't worry about dinner, we got this. And that's our community. As much as we are there for our communities, they were there for us. They brought us food, they brought us drink, they brought us gifts. They brought us anything, support, love, the convoy, the caravan, and the claps, and the cheer, and the horns, and the hugs, and the ambulance, and the EMS. All the essential workers were there for us. That was just remarkable. Because of COVID-19, I rediscovered nursing and my love for the profession. I'm grateful each morning that I had the privilege to wear my scrubs and care for patients. I'm thankful each evening that I get to go home and have dinner with my family. And I just know that this was the right profession that I chose. And I'm a proud nurse. As long as I'm healthy, I will be there for Mount Sinai South Nassau. I will be there.
My daughter, every time she sees me take off my mask, if somebody comes close, she'll remind me, Mommy, your mask. Because I tell her it's to protect you, it's to protect the person next to me. Less so now than before because we're more knowledgeable of the disease process, but in the beginning it was constant fear. You walk in and you feel like you're walking into a battle zone, and then you leave and you take it with you, no matter how much you try not to. Emotionally, physically, it's taking a toll. You're on 24/7. You feel bad even leaving to go eat because these patients are so sick that you don't even want to leave sometimes. Just to take a breath, or even because you feel like that 10 seconds you leave, those are 10 seconds that patient will need you. I feel more confident, but I still, in the back of my mind, always have that doubt. You know, am I bringing something home? Am I, gonna cause my loved ones to be sick? So, yeah, it's changed me a lot. It lingers when I go home. It lingers while I'm at work, trying to make sure not only I protect myself, I protect my colleagues. I mean, it's amazing that there's the internet and, FaceTiming and Zoom, and we're able to actually see each other, but you don't realize how much a hug means until you can't get one or give one. My downtime when the kids are in bed, and that's when I have to kind of reflect and pray and kind of let myself be sad and cry and allow myself time to grieve. That's not something I really did a lot of before. I've worked in intensive care and critical care for a very long time, and it's not like I'm not familiar with that. But I was always able to, allow the grieving process for everybody else and kind of separate myself. And with this, it's just, that's not happening. So allowing myself to kind of grieve for the loss of other people and for the entire situation that we have to overcome. And then tell myself, you've got to stay strong because they need you, your kids need you. We will get through this. That's what I have to keep telling myself. Luckily, we have an amazing team of doctors, PAs, NPs, colleagues of nurses that banded together to make it bearable, even in the times where it wasn't. I understand what these families are going through. I understand them not being able to hold their loved ones' hands when they're so sick. Having that capacity to let them see their loved ones when they can't, that needs to be carried on even when this is over. So having the iPad and me telling them, listen, at 3:00, I'm gonna let you see your loved one, and I'm gonna tell you everything that's going on, and have them see my face, even if it's my masked face, so they can almost like feel the empathy that I have for them. I think it gives them confidence that their loved ones are being taken care of like a loved one.
I was hired in October, so it was an orientation for about 6 months. I've been by myself as a nurse, working independently for about 7 weeks now. Before the surge began here in New York City, the information was just minimal, almost like whatever we were getting. I remember thinking that it was definitely something that was scary. I thought that a virus can be spread so rapidly and people were getting sick so fast, and just wondering if it was going to come here, what was going to happen when it did come here, and just kind of anticipating what the hospital would be like. I was thinking that it was going to get here sooner or later. I felt like, just from what we were hearing, that the virus was very likely to spread. I felt like the hospital had to do a lot to just change overnight. One day you were there and it was kind of like almost normal every day. Like we were talking about, what would happen if this did come, and then the next day we were reading protocols about what we were doing and what type of PPE we would wear, things like that. It was a little bit stressful, just kind of overwhelming at the time, especially as a new grad, just being overwhelmed with that. But you're more used to it as you come in every day and do your job. I believe that this experience just changes you as a person. You become, if you weren't already, very compassionate, which I feel like I was, just to become more compassionate. That, there's some patients that are coming in that are so ill, are declining rapidly, that you have to be able to help them make the right judgment calls. Your experience as a nurse changes once you become part of this whole pandemic, because it's so much more experience that you have. You can work with the continuity of care as a nurse and be able to do the day-to-day things. When it comes to somebody who's so critically ill that you have to be able to think on the fly, work together with other people. I feel like I have the more experience now than I ever will. I'm a nurse that's 7 months been working. I feel like I've almost been doing this for 2 years now. I can remember one specific moment that I think I'm always going to remember in my nursing career now. A man that was in his 40s, I formed a relationship with him. I had him as a patient for about 4 nights in a row. He was telling me about his kids, about his family, how he wanted to get home as soon as possible. just to get better. We play the song Here Comes the Sun when people get discharged. I was in that room. I happened to be talking to him at the time, and he heard the music, and it was the first time he had heard it as well. And he looked at me and he said, "Oh, what's that music for?" And I was like, "Oh, it's a song that we play when people with COVID get discharged." He just looked at me and said, I hope one day that music's for me. At that point, when I had formed that bond with him, I said that that's the bright side to look at, that you are getting better, that you need to just keep a positive attitude, because I know it's very easy to not have one during a time like this. It was about a week after that, he got much better. His oxygen saturation got a lot better. Yeah, he's home now. To be able to have such a positive story, especially with somebody that I had a little bit of a bond with, and for him to go home, it was the happiest I've been since I've probably been on this job.
We were operating in this sense of, okay, we can handle this, and the numbers were coming in, and we were seeing some unique pieces to this illness, but we weren't seeing that explosion or acceleration of transmissibility. You know, the 10 to 100 to 1,000. Initially, we were seeing 1 and 2 patients at a time with a very unique, complex respiratory illness and what we call a cytokine surge state. And it was unique in the sense that we knew what to do. We knew when they were losing their ability to breathe that we would have to breathe for them. The aha moment came somewhere, I would say, in about the 2nd to 3rd week in March, and I wasn't sleeping very much, and I was studying the numbers, and I was really trying to make sure that we were planning not just a day in advance, but a week in advance. As you know, not only were our staff getting sick, but initially people were just getting exposed, and exposure enough were forcing frontline staff to stay at home. And that was going to be catastrophic. So I knew we had to regain our staff. We had to maintain our staff as best as possible. And the aha moment came about the 3rd week when one day in the ER, I just saw the complexity of care go from, let's say, a 5 out of 10 to an 11. Everybody was sick, and everybody started to become compromised. Those folks we were sending home a week before, because they were a little sick and a little flu-like, were coming back, and they were coming back in dire need of life-sustaining efforts. And it wasn't just 1 or 2 of them, it was all of them. And that was scary. So, you know, normally we do a very good job at triaging and treating and releasing those who don't need hospitalization. This was an illness where we couldn't predict who was, as I always said, who's going to fall off the curve of getting better. And I think that we learned a lot from that. And so the aha moment came about the 3rd week when I saw the acceleration of disease, the numbers of patients. We were already losing staff, and I was starting to get concerned. But I knew in my heart that the light was there. I just had to go find it, you know, the light at the end of the tunnel I'm talking about. So I just kept very optimistic, and I think that, you know, I always say that optimism is a force multiplier. So you stay optimistic, you tell people that you're optimistic, and they feel optimistic, and that optimism can help see people through pretty hard times. I knew it was bigger than me, and I think it was the idea that I belonged to a system that was going to be supportive. My staff, you know, watching them stand up every day, despite what was coming in and not knowing what the next day would bring, gave me incredible strength. I knew I couldn't fail, knowing that I had such a great team.
I don't think we ever thought that we were going to get hit as hard as we did. They would trickle in, and then all of a sudden, just one day they were, you know, it was COVID everywhere. All the areas had to be surged. We got hit with a bombardment of ICU, the most critical patients that I've ever encountered. Staff from everywhere that came to help us. We had agency nurses, D4 attendants coming down. Anybody that came down was willing to help us. When all the ambulances came, you know, we have an ambulance triage, and they would line up down the row from the ambulance bay, going maybe all the way down, you know, down the hallway. I just had to remind myself to stay calm myself so that they would remain calm. And you're doing a great job. You know, we're proud of you. You know, you could do this. We're all in this together. It was a total team effort. You know, you're not alone. It was many, many heartbreaking incidents. Probably the most heartbreaking incidents that we've ever had. You know, everybody was reminded you do the best that you can, and they all gave the best that they can. And you can't ask for anything more than that. I had brand new nurses that were less than a year from the residency program, the ER residency program, and they got baptized by fire. Everyone came in scared, and they stepped up, and everybody was amazing. You know, we get through the day as best we can. You cry, you move on. Then I would pass off my shift to the next charge nurse and do a huddle and prepare the night staff for what they were going to come into. You know, what could we do to help them? Do we have enough supplies for the night staff? My source of strength came from my teammates, EMS, my supervisors, everybody in the hospital that had to take on different roles and that they'd never done before. The housekeeping staff that was there the minute you needed them, you know, like working tirelessly, transportation that had beds lined up for us, the staff that came to help us that never had been in the emergency room, that wanted to do anything, the community support, sending endless amounts of food and PPE, and the fire departments that were outside, you know, cheering us on. And, you know, you took strength in all of that, and your teammates working together, knowing that we were never alone and everyone was supporting us. It's just a tremendous team effort by everybody.
My role at the hospital is that I'm the emergency manager here at Mount Sinai South Nassau, and that means that I'm responsible for managing the emergency preparedness activities at the hospital and all of the off-site or outside facilities as well. Once we were hit with COVID-19, my role became almost exclusively dedicated to the COVID-19 response. So what that means is when we started to have patients that were experiencing symptoms of COVID-19, we activated our emergency management plan, and we opened up our hospital command center, which is where all the command and control for the COVID-19 response takes place. And our incident management team and our leadership will operate out of that hospital command center, and I am placed in that command center as well, so that we can track and coordinate our response. In the command center, we are conducting meetings to ensure, virtual meetings, to ensure that we are coordinating our response across the hospital, that we are setting our objectives to how we want to respond to this emergency, and we're carrying out those actions after developing a specific action plan. We're also fielding all the issues from all the different departments that may come up during the response, whether it's that they may need equipment or they're faced with patients that they are not able to place. We may need to possibly open up an additional unit. There are issues of family members that, especially once we implemented our no visiting policy, that we had to make accommodations for families so that they could still see their loved ones while they're in the hospital. And for example, that would be the virtual visits we're doing, where we are providing iPads to patients and having staff help the patients conduct a virtual visit, a FaceTime visit with their family. We always hope that the actual magnitude of what we experience is less than what we prepared for, but we stockpiled PPE a certain amount. It wasn't enough. We had to continue to get more than what we stockpiled for. But we continue to evolve and continue to make changes to our plans and our response as the situation evolves. We really need to give a very strong focus on emergency management. And we always have in this hospital. Emergency management, emergency preparedness has always been a huge focus in this hospital. We meet all the time and are looking at our plans and looking at different crises that we might encounter and how to mitigate those possible incidents. But I think the focus will be even stronger. I think there will be many more requirements that we will have to make sure are in place. We've always considered every nook and cranny that we can put patients in the hospital, but I think it's going to be taken a step further. And I think the world of emergency management is going to expand a great deal. A pandemic was not at the top of the list. This is going way up to the top at this point, and we're really going to need to focus our planning and mitigation strategies on this.
I'm the nurse manager of the pediatric floor, but when COVID-19 happened, the pediatric floor became an adult COVID floor. It was a big adjustment, and it happened very quickly. The staff had to turn their roles and start taking care of type of patients they've never taken care of before. Many elderly adults that were extremely sick and we didn't have children. We had to get all the cribs off the floor and get beds and all different equipment. During this time, I tried very hard to be supportive. I was constantly asking, what do you need? Making sure they had enough personal protective equipment, making sure they had, a pat on the back or a little support. But I was up doing whatever they needed. No task was too big or too small. It's all part of being part of a team, and we all worked well together. I saw incredible teamwork. I feel blessed to be part of this time, the COVID-19 pandemic, because if I had read about it in a history book, or if I had seen it, as a student in school, or after I retired, I would have wanted to come and help out. So I'm glad that I was able to help during this time. I found my strength at a lot of places. First of all, you saw the CNO wearing scrubs, which, and help. They were all helping out. Margaret Pfeiffer was helping with patient care. That was huge. The support from the community was tremendous, such community support. But I also saw strength in the fact that the unsung heroes were getting recognition, like our EVS workers were all of a sudden being acknowledged, and they work so hard all the time that that helped give me strength too in this whole time period. I walk to work. I like to walk to work. It gives me a few minutes to clear my head before and at the end of work, and I live close. And then I come in, and the first thing I do is look at the assignment, look at the team, look at what type of patients are on the floor, and give everybody the little pep talk. Then everybody starts looking, and I walk around and give everything a general wipe down again. We're constantly wiping things down these days. And I check on the patients, ask the nurses what they need. That's how the days went. They went really fast, actually. The time went really fast. And then when you went home, you had to do the same thing backwards. First thing you do is take a shower, get rid of, the dirty clothes, sit down, catch up on the family. They're all anxious to hear what happened because they've been in the house all day with nothing going on. And I had so much going on, but there were times I didn't want to talk about it either because some of the things I saw were really sad. And then make sure you eat enough, make sure you get enough rest because tomorrow morning you have to do it again. I will definitely see things differently. You're going to look at casual situation as potential hazards, and you're going to be more aware of what dangers are out there, I think. But you're also going to be more aware of the strengths out there and who to reach out to and what's important. It's not about things and it's not about where you go, it's about the people you're with. I think that's the biggest thing I learned. When my unit becomes a full pediatric unit again, I think will be when everything seems normal. We are taking care of adults because the kids have been home in their houses. They're not exposing each other to bacteria and germs. They're not getting sick. They're not getting hurt from sports injuries. When the children come back on the floor, then we'll know that things are normal again out in the community.
We started preparing in February and planning and strategic conversations related to where we would open up our first COVID unit. We never knew that we'd be opening up 10 more right after that. We didn't have any cases in New York in February, which was kind of shocking. We had cases in the rest of the country. There was this presumption that some of the travel bans may have had some benefit. We didn't recognize that there's a significant lag time between when the disease was present in the New York City area and when we started getting to see that people were getting symptomatic. And then there's always that hope that you'll dodge the bullet, so to speak, but we did not. That first weekend was really our pivotal weekend, that weekend of March 13th. And in a normal environment, it would have taken us weeks to do what we did in 2 days. And that's one of the things that was amazing about the staff's response, is that we were able to really accomplish things in short order that had historically been things that would have taken significant more time. So we moved all of the sleep quarters down into the conference rooms. We moved the infusion center into another conference room, which had a separate exit, so it would allow patients some safety. Immediately, we were able to open up 2 units that were going to be dedicated towards these patients. The challenge was we had no testing. So we had to have single rooms for every single patient because you never knew which patient had it by test and which one was pneumonia from flu or something else. And again, this was earlier on, so we weren't as familiar with the disease process. So every day we saw that there were just more and more patients. We had to find places that were safe, negative pressure. We had to work with engineering and with facilities to make sure that the air was exhausted out. We don't have all the negative pressure rooms in the hospital that it would require to take care of. At our peak, we had about 405 patients, COVID positive patients in the hospital. We don't have 405 negative pressure rooms. In fact, we don't have 405 single rooms. So working with facilities to do all the engineering behind the scenes to make sure both the staff were kept safe and the rest of the hospital was kept safe, those are important steps that they happen behind the scenes. No one knows that they're happening. But our conversion rate in terms of how many of our staff got sick is very low. So it really showed that everything we were doing was helping to keep people safe and allowing them to take care of these patients. I mean, after all, the staff, they're all putting their lives at risk. They're putting their families' lives at risk, and certainly at the very least their health at risk. So the least we could do is make sure they were protected to the fullest extent that we could do that. The PPE did work by and large. A lot of our staff got sick from prior to our PPE protocols being in place when we weren't aware that it was in the hospital. Our first patient, no one knew if they were COVID positive for quite some time because of testing was really unavailable. And then we lost staff, and that's exceptionally heartbreaking because we're here to help and we're not soldiers. So it's not common for us to lose staff that way. They call it the front line, but it's not a front line for us. It's bedside, we're providing care. There are no bullets. And so we don't expect people to die by showing up to work. So that was really tough. And for the families that lost their loved ones, how are they gonna recover from that? It's impossible. So we've worked hard to create separation so patients can be safe, whether they have COVID or whether they don't have COVID. We want all our patients to be safe.
My role here is Mount Sinai South Nassau. Prior to COVID, I was a floor staff nurse. I took a patient load. It was about, on a good day, 6 to 7 patients, really. It was a surgical floor. We'd get a lot of craniotomies, a lot of hip surgery, back surgeries. We are step down as well. So we do have beds for patients that aren't really, critical care material, but they still require a lot of attention. So my role started to change in about October of 2019. I was asked to become the assistant nurse manager of E2. I accepted. I thought it was a privilege. A lot of my coworkers looked up to me and as a resource, so I thought I could help them better by becoming assistant nurse manager. I started getting trained, according to our floor, and then around January, February, we started hearing about the coronavirus. So we said it's not gonna come to our floor. We're surgical. I know people get surgeries. They need these kind of floors. So no one was really that worried at first. Then we started hearing about the coronavirus and how now our floor is very large. It's a 36-bed unit. They need the space because of how rapidly it was advancing. So they had us transition all our patients to a different floor, which was D1 East at the time. So we had to move every single patient that we had over to D1 East, and then we had to start receiving coronavirus patients. It was very stressful for the staff. A lot of them were scared. They didn't know where to begin. I was new to the management role, so I didn't know how to approach it or what techniques. I wasn't experienced enough yet. So it kind of forced me to have to become experienced really fast. I had to say, hey, listen, this is my role now. Let me take care of these patients and my staff. So we moved everyone, we got the patients in, and then I had to find a way to kind of relieve the stress on my staff, which is very difficult at the beginning. So the way I approached it, I said, hey guys, listen, we're all in this together. I'll go into these rooms with you and I'll share what I know, what knowledge I have. And I kept up to date with the literature, and that's how I found a way to also take care of my staff. So what inspired me to come in every day and push through the struggle and the hardship of coronavirus and what it was doing to our patients was really the patients themselves. They were scared, alone. The hospital, wasn't allowing any visitors to protect the population, the public. So a lot of them were scared, they didn't know what to do. They looked to us as the professionals to take care of them. As draining as it was, I was putting in the hours, despite whether, as a manager, I don't always get paid overtime. I wasn't thinking about the money, I wasn't thinking about the overtime. I didn't leave the day until I made sure that whoever is on my floor was stable. So the staff is happy. That makes me happy, and we're moving forward.
When I was hired to be the nurse manager for labor and delivery. Shortly after coming here, I came here February 24th. I had my 2 weeks of orientation through the hospital and nursing ed. and then I came to the unit. I probably worked on the unit for just about a week when the pandemic really started to come and start to really be hitting us in a big way that first week. There were a lot of policy changes. There was a lot of things that were happening minute to minute, hour to hour, day to day that we were changing, whether it was how we wore PPE. Was it reusable? Was it not? And then over the weekend, then the ordinance came that mothers were going to have to start delivering on their own. And they would not be accompanied by a support person, that the nurse would take care of them, that we were eliminating all visitation. There was really a lot of negative feedback on that, a lot of pushback. So that was very difficult to navigate, because in the midst of all of this, things were changing quickly. But meanwhile, just 2 days before that, there were people that did have people staying with them. And so it was very hard to manage those expectations and what was happening and the backlash that we were getting from it. It was difficult because there was just so little information about what was happening with this. Who was the susceptible populations? Women are generally more at risk for diseases in pregnancy. We consider them an at-risk population, and neonates as well. But the information that we were receiving was, based on what was happening over in Europe and over in China, that there wasn't a lot of pregnant patients, or there wasn't data. We just didn't have anything. So it was worrisome as to what were we going to see these patients looking like? What were they going to present like? What were we going to do for them if they needed ventilatory support and they were here on a labor and delivery unit? Because most of the times, greater than 20 weeks, you bring them to labor and delivery, and sometimes medicine will consult, will keep them in the maternity. But if you have somebody with, severe respiratory issues, labor and delivery is not necessarily the place for them. We don't have an ICU, we don't have vents other than ORs, so it's not an ideal situation. So what were we going to do with them? How are we going to manage them? How are we going to escalate that? Who is going to take them? Because at the same time, the hospital is starting to fill up as well. So it wasn't like we had an abundance of spots to place people. It was very worrisome, who comes through, who gets sent up to us, who gets managed downstairs by the ED, and we come and consult. So there were all these types of different conversations, and I think that was probably the most stressful for the staff. Where normally we would take them up to labor and delivery, we would evaluate them, and then we would, make referrals based on what they need. That's normally how we do things in labor and delivery, but that wasn't it at all. We really wanted to eliminate the foot traffic through the unit. It's a small unit, it's not very big, and we wanted to really provide safe care. I really love being with the nurses and really forming camaraderie and really leading them through this. That's really the biggest thing. Your staff needs you, so you really need to be there for your staff.
I worked in the operating room, and then I was shifted over to the float pool. My role stays the same as a nurse, but just have to be in the flexible mode and, be able to go to the different places and floors that they ask of you. When I first got on the floor, I was very nervous. I had some patients that were on vents, some were on some heavy duty drips. Other days I had to go to the ICUs. Most of the places turned into ICUs. Some were bigger floors than others. But some days I tasked, but other days I had my own patients. So it just became my normal day. I wasn't scared. I think it was 2 hours after the fact that I got over the nervousness, and I said, I'm here, I have to do what I have to do. As a nurse, I became a nurse a long time ago. It's because I want to be able to help people, and that hasn't changed. I think my source of strength is really just looking around me and seeing the good of other people. My family's been amazing. They're so good. My friends have been so supportive. Even my coworkers, everybody is really, really working together. And I love what I see. I say sometimes bad things happen, but people really pull together in the worst times. And it's been an amazing thing to see. It's definitely grounded me a lot more. I just really appreciate things, knowing what I've seen and how fast someone can lose their life with this virus. It's definitely changed me. I've always been a little bit of an emotional person, but this definitely hit hard. you know. I'm very proud of everyone. Everyone is, you know, pulled together and they've worked together. People that, you know, never been on a floor, you know, took charge and said, we can do this, and everybody's helped everyone out. I don't think I've ever had a bad experience with asking someone to say, hey, can you help me for a minute? My coworkers have been amazing, and just want to say I'm so proud of them. I think from going from the OR to the float, you know, pool was a big transition. I like what I'm doing. You know, I like the OR also, but I like being with those people that really don't have that family member next to them. I come in and I want to be able to be there because I know a lot of the families that can't be there. So I would like to be that person, you know, to maybe hold that person's hand or, you know, rub their head and just tell them that it's going to be okay. So that gives me a big drive to get up in the morning and say, maybe today I'll make somebody's day different. And I hope that I do.
Through family medicine, we rotate through all the different specialties. We hit on the outpatient clinic setting, we hit on the inpatient medicine side, we rotate through surgery, through OBGYN, orthopedics, ophthalmology, essentially every branch of medicine. And we try to get in our residency program a picture of each subspecialty, primarily how we can help the patient navigate through the medical system that we have. Everything changed on March 16th, that Monday. The entire clinic shut down that day. It was essentially the day that COVID had reached a critical mass in New York. It had affected our hospital. We had been notified that we had patients that had COVID in the hospital. There were patients that were intubated. The ICU was starting to fill up. The emergency room was starting to overflow. And we didn't know how we were going to handle the outpatient setting. We didn't know if it was safe to bring people in. We didn't know how it was being spread just yet. We didn't know what dangers it posed for any of our patients. And to make matters worse, there were people in our own department that received a positive diagnosis that day as well. So our clinic closed, and all of the appointments that we had scheduled for that day were canceled immediately, and we were told to evacuate. We are primarily in the outpatient setting, and we have to keep our patients in the community safe before they get to the hospital so that we don't overwhelm the hospital system. And it was important for us to continue to do that, to continue to keep those patients in the community safe. And so we wanted to make sure that their chronic medical conditions, that their diabetes, that their high blood pressure, that their heart failure, that everything stayed well controlled so that we had beds in the hospital. And so every day we came in the clinic, we answered those phone calls, we did the medication refills, we called every single patient. How's your blood pressure? How's your blood sugar? Are you taking everything? Do you have any questions? Do you have any concerns? All of the nervous patients with questions about COVID, you know, how could we answer? We had a group, a community that we were constantly sending news articles, journal articles out of China, out of South Korea, out of Seattle. We were joining conference calls with Italy at one point to try to see what we could learn from the rest of the world, so that in our own community here in Oceanside and Rockville Center and the 5 towns, that we could protect everybody as best as we could. And we gathered all that information and we applied it as best as we can. Anywhere we could help, we did.
This is a disease that is not compared to any disease that I have seen in my career. I have seen SARS, I have seen Ebola, but I have never seen a pandemic of COVID coronavirus in my life. I facilitate the weaning processes of getting patients off the respirators. I work together with the intensivists and the RNs to try and expedite this process and to try and reduce the length of stay of patients on ventilators and in ICU to get them back off going home. The first patient that I came across was in CCU 9. He had not been diagnosed as COVID, and because we did not know that he was a COVID patient, we just thought he was in ARDS. ARDS is Adult Respiratory Distress Syndrome because he displayed all the symptoms. And after a couple of days, it was decided that we would have him tested for COVID. So he was tested on Tuesday, and on a Friday morning, we got the results that he was a positive COVID patient. At that time, I think fear, anxiety, this feeling of this unsettling feeling, and knowing, have we been exposed to this? Or have we exposed our other patients to this? You know? And that sense of fear and chaos is an undescribable emotion. But then you have to pull yourself together and say it is what it is now. And we have to do the best that we can to see what we can do to help this man and the ones that are going to be coming through our emergency room doors. And this is when we got together, and our manager got us together as a team to provide us with that sense of calm that, listen, it's going to be okay. We are the frontliners. We are the first responders. And this is what we are made for, to take care of these people at this time. When all these patients started to come through the emergency room in severe respiratory distress, we as a team could not cope with the amount of patients that were coming through. On a normal day, we have 12 to 14 patients in the unit. We were all full everywhere. Most of the floors were completely filled with COVID patients. And at that time, we realized that we needed to seek help. The physicians, the nurse practitioners, the physician assistants, the surgeons, all came in. Anesthesiologists as well came in to help us out so that we could take care of the patients that needed to be taken care of and concentrate on taking care of those severely sick patients. In this time, with the COVID, my determination was to keep them alive. To keep them alive because they were dying in masses. So I gave my utmost at all times to make sure that they don't ever feel neglected in a way. So whatever I could do for these patients to make them feel at ease, knowing that they are having such a hard time breathing, and at the same time comforting them, to let them know that they are not alone and we are here as a team to take care of them and make sure that they are going to be okay, and try and reassure them as much as I could that it was going to be okay. So to see patients dying was very saddening because I was driven to get them off. But at the same time, to be able to get a patient off as a team was the biggest uplifting feeling, to know that we as a team were able to save a life. And we made an impact in that man's life for him to be able to breathe again, you know? And we work like that every day. But at the same time, I have dealt with such excellent intensivists, excellent RNs. And the RNs themselves were not completely intensive care unit nurses. These are nurses from all other departments who had to be trained and were willing to learn and were willing to help in any way that they could, to be of any help to us. And that's something you cannot express in words. You have to be in it to understand it and appreciate. Because it was a chaotic time. It was a sad, sad time. It's not easy. It hasn't been easy. But I take away from this knowing that the people that I have extubated have done well. And I pray that we can continue to do so as this pandemic continues. And I pray that it ends well. I've been doing this for many years. But as I learn about this disease every day, it just makes me more determined to be able to be there and just know that I have to give my best and continue giving my best and never back off. And to let this coronavirus know that at the end of the day, we will prevail.